I'm Sarah Stewart. I'm a family nurse practitioner, and I am also certified in obesity medicine by the Obesity Medicine Association. And I wanted to share a little bit about my continuous glucose monitor. I started monitoring with a CGM about 3 months ago using a Freestyle Libre 2. And I started to monitor because I had some labs drawn in April that were pretty shocking. My A1C was 5.6, and an A1C of 5.7 or greater is diagnostic for prediabetes. My fasting glucose was 115. A normal fasting glucose would be 70 to 100. I had a fasting insulin level checked, which was 7, and depending on what source you reference, some say greater than 7 indicates resistance. Some say greater than 10 indicates resistance. So again, I knew that I wanted to make some changes in my routine. I thought I was on track. I considered myself very active. I eat 2 meals within an 8-hour window. I don't snack. I don't consume added sugars on the rare occasion for a birthday or something. But to get these labs back again, it kind of was a wake-up call. So I started monitoring with the Freestyle Libre 2, and I started seeing over the last couple months my glucose really was running abnormally high. So fasting, sometimes in the 140s, which technically a fasting glucose greater than 126 can also be diagnostic for type 2 diabetes. So A1C greater than 6.5 or a fasting glucose greater than 126. And I was doing some intermittent fasting. I even did a 48-hour fast for all the other numerous health benefits for it, but also to try to, get this glucose down. And so I'm really excited. I'm switching over to the Dexcom G7, which is now covered by my insurance. So what the Dexcom G7 will do is actually automatically check my glucose every 5 minutes without me having to scan it like the Freestyle. And, why monitor? 88% of US adults have at least one indicator of metabolic dysfunction. So what is metabolic dysfunction or metabolic syndrome? Metabolic syndrome, also known as insulin resistance syndrome, is like a cluster of conditions or symptoms or criteria that indicate metabolic dysfunction. So I'm going to use the American Academy of Clinical Endocrinology for their guidelines, and that would be a BMI of greater than 25, or a waist circumference for men greater than 40 inches, for women greater than 35 inches. That waist circumference is kind of like a proxy for like the visceral fat. So the visceral is like the deep intra-abdominal, dangerous belly fat that infiltrates the vital organs, causes fatty liver disease, goes into the pancreas, right? So that waist circumference is an easy way to kind of see if you have a high amount of visceral or like metabolic dysfunction going on. And so that's mandatory, and at least 2 of the following criteria. So fasting glucose greater than 110, HDL, which is like our good cholesterol, it's reflective of our level of physical activity. HDL for men less than 40 or for women less than 50. Triglycerides greater than 150. Blood pressure greater than 130 over 85 or on medication for blood pressure, hypertension. Another indicator I also like to use in the office is the triglyceride HDL ratio. So you take your triglycerides divided by HDL, and this number for Caucasians, if it's greater than 2.5, or for African Americans, if it's greater than 1.5, this is also like a proxy measurement that would indicate metabolic syndrome or metabolic dysfunction. So again, 88% of US adults have at least one indicator of metabolic dysfunction, and depending on where that metabolic dysfunction is showing up, it can present as any number of symptoms or conditions. And so if you're unable to get like a glucose monitor, a CGM covered by insurance, you can easily pick up just like a $20 glucometer and start monitoring your fasting blood sugars in the morning and before meals. And another thing I'd like to do is measure my glucose throughout a meal. So start of the meal fasting every 15 minutes, or you do every 30 minutes for 2 hours. And what you like to see is that glucose kind of resume back to the pre-meal glucose. And if you're seeing like these massive spikes in glucose, you can assume that you're also spiking insulin levels. And as somebody who has, some obesity medicine training, insulin is like the primary hormone driving weight gain. So for me, that's like a major target for weight management, is to get glucose and insulin levels down. So I am going to set this up real quick here. I think I want to do it on this arm so I don't have to scan. Let's see. Oh, great. All right, reach out if you have any questions. Take care of yourself.